All right, Lindsay. So I received your Instagram message asking about whether or not there was any stigma really noticed among like people with COVID and herpes. Was that the question?
Yeah, or if you had noticed, like, maybe amongst your own community, like, is there a lot of COVID transmission stigma, much in the same way that we see it with HSV or HIV, because of that kind of viral element and that it's so contagious?
So this came up in conversations with someone. Well, actually, a few people have asked about it, and by a few, I only mean like three or four. I don't think there's enough really data or information available or any at all really to really speak into details or say anything as fact or not. But what we do have is like, if you look at it from a stigma perspective, it's very interesting how COVID-19 is a virus, HSV is a virus. Granted, obviously COVID has mortalities. HSV, as far as we know, hasn't killed anyone. And if I'm wrong about that, message me, whatever. But how we're responding to this virus and taking all of the precautions that are readily available to us on a global scale. Think about it, like sports are shut down and there's people wearing masks, people are showering more, washing their hands, and taking so many precautions to avoid getting this virus. And it almost seems like it seems like there's not enough that can be done. And then when we look at it from a herpes perspective, um, the precautions there are so limited. I mean, there's a medication that lowers the risk, but people still get it. And then there's being asymptomatic, just like you can be with COVID. And it just really creates all this like idealistic dialogue because there's similarities, but there's differences at the same time. So it's not it'll be interesting to see how we navigate things moving forward because with herpes being an STD, and we talk about STIs, STDs interchangeably, but when we're going to be sexually intimate with someone and we're putting them at risk of exposure to the virus, we talk about our sexual health status. Now, we're in a climate now where we're talking about COVID, right? And people needing to know, okay, have you been in contact with anyone else in the last 14 days? What's your risk factors? Do you work in the medical community? Are you exposed to people? Do you know anyone who's had this virus? And the conversation there is it'll be interesting to see how these go as we move forward in the future, because it's kind of a similar conversation that maybe we should have, maybe we shouldn't have, in relation to putting someone at risk of contracting a virus. But again, we can be asymptomatic for both of these, not know it, and then pass it on to someone. So I don't have an answer as far as stigma goes, but it does bring up the discussion of how these two things relate and how in the future discussions around not just sexual health but our health in general, like overall universally, this really shifts how we look at discussions around our health, right? So you and I spoke before we did this call, and I kind of wish I would have just hit record and let you talk, but I'm going to do that now. If you want, you can go ahead and just go into the story in as much detail as you want, and then I'll just jump in. So, you were diagnosed yesterday, April 22nd. I don't know what day it is anymore, April 23rd, with COVID
Yep,
19.
Friday the 23rd. Yep, and we think that I contracted it somewhere around the 5th.
Oh wow. So we're talking about almost 3 weeks if we think that you had first contracted it April 5th, and it's April 23rd now. We're looking at almost 3 weeks.
Yep. So we were looking at my timeline with different patients, and I'm lucky enough to be able to actually quantify my exposures because I am on, care logs on my patients' doors. So that way, if it's a person who we are thinking about testing or who has COVID-like symptoms, then my occupational health team is able to call me and say, hey, you were exposed and we see that you were asked not to use a certain type of PPE with this patient because we thought we were ruling them out. Well, it turns out that they're positive. So that way I know to wear a mask or to isolate in a particular way. We're hazarding a guess, the Department of Health, and I, based on that timeline, that I may have contracted the disease somewhere between the 5th and the 10th. But it's, there's really no way of knowing. I developed a fever on the 14th of April, and then my fever resolved on the 17th, and I was cleared to go back to work again. Then 5 days later, I developed more symptoms, and that was losing my sense of taste and smell, myalgia, which appeared as just a headache, but it's a nerve pain that's associated with the virus that can feel like a sinus headache or a backache. And then I developed shortly after that, probably 48 hours later, shortness of breath and fatigue. And those are the only symptoms that I'm really dealing with right now. But it's really, with the exception of my fever, been pretty mild and very sneaky in terms of how it's felt physically. It didn't happen all at once. It really didn't hit me like a ton of bricks. It could have felt like it was not at all what I was expecting. And I don't think that it was what our diagnosis algorithms really suggest as, it took a full week, almost a week and a half, for anyone to say, oh, hey, danger, you're going to want to completely isolate. There was a lot of back and forth, I think, because it was so mild. So I'm encouraging other people to be aware of that, because it definitely took me by surprise. It took my partner by surprise. It took my parents by surprise. And we all, are pretty on board with social distancing and, hand washing, all kinds of different kinds of preventative measures. But, you think COVID, you think of a very severe illness. I definitely did not think of this mild sort of, the clinical term is malaise, just feeling kind of crummy. Mm-hmm. That's it. And I think with young people too, a lot more of us will discover when we do serology and antibody testing that we've had this and didn't know it than I think than we initially imagined.
Mm-hmm. What's the test look like? What's the testing process for COVID?
So my hospital has a very limited number of tests because we're in New York State, and we've had a lot of trouble getting tests, but it's a swab. We do not have a blood test that we're doing yet. I don't even know if there's been one approved in the United States yet, but basically what they do, it's very similar to influenza testing. So anybody who's had that knows it's a little uncomfortable. They basically take a very long Q-tip and put it as far up your nose as they can for 5 seconds. And if you have a sinus headache already, it sucks. But it's over in a snap. I pulled up in my car and they swabbed me right there. Someone came out in all of her PPE with her face shield, and it's a PA that I work with, and she tested me, and then I got out of there. And so right now, I think the majority of the United States, you either need a physician's order, or they're testing you when you're already a hospital patient if you have symptoms. We have right now. I got my order through occupational medicine at my hospital. They needed to know that so that I could go back to work. We are doing public testing as well. If someone calls their general practitioner, they can get an order for a test, and it's a paper order, and they just drive up to a testing site. A lot of grocery stores are making this possible, and Targets and things like that. And they repeat the process there. So it's that swab. It goes in a little vial, and then it gets sent to a lab, and they look for the DNA of the virus, and they use something called the polymerase chain reaction. So that's the PCR test that we are all hearing a lot about on the news. That's what that looks like.
Okay. This may be a silly question, but if you are positive and you don't seem to really have heavy symptoms, why can't you continue to work with the COVID patients?
I could continue to work with COVID patients, but any of my coworkers that have not contracted the disease would then be at risk from me, because I am around them without certain types of PPE on. So if I didn't know I had the virus and I was sharing like a computer or something, even if I had a surgical mask on, that could still put the person next to me at risk, even if they're 3 feet away. And so in hospitals or any workplace, we have lots and lots of high-touch surfaces, lots of countertops, phones, keyboards, door handles, coffee makers, whatever. We want people going back to work when they are the least contagious. So when someone's diagnosed, their ability to transmit the disease gets really, really high, and then it levels off and eventually decreases to where we're not passing it on to each other. It's getting people isolated during the window that they're the most contagious and when they have the highest viral load. So when we talk about HSV with what our viral load is, we know we can decrease that with HSV medications or with stress reduction and having a healthy immune system. We can't do that with COVID. We can only do that with time. So I can't go back to work until I'm no longer contagious, because I come in. I also work with a lot of patients who do not have COVID, and I work in an ancillary department where I work with patients in pretty much every unit of the hospital. The only individuals that I don't come into contact with are usually newborn babies.
Okay.
So, I am hands-on with patients, so I am around a lot of different people, and I think that was one of the reasons that they said, yeah, don't come back to work yet. I was a little surprised after my fever that they said, yeah, come back in, like, you're good to go on Monday. But I also think that when it comes to healthy younger people, I noticed that our healthcare system doesn't typically take them very seriously.
So when you say that, you mean like you mentioned with me that you get reoccurring ear infections and you get fevers, and so during this time, that having been a norm for you, what made this particular time that you got a fever different? Is it just the climate that we're in, where it's like, oh wait, you got a fever now in this window, we're going to test you for COVID, not, oh, this is more of like your chronic fever and ear infection that you get?
Yep. If this had been last year at this time, I think they would have been saying, well, can you take some Tylenol and come in anyway? And this time they said, don't take any Tylenol. We want to see how high your fever gets and for how long. and we want it to go away on its own. We don't want you to treat it with anything. And that sucked. But after about 72 hours, I didn't have a fever anymore. And so they said, all right, if you don't have a fever, then you must be fine, because I didn't have any other symptoms. I didn't add, I think usually we're looking at, okay, somebody's not feeling good. We're waiting for it to snowball and to see. They started with a fever, now they've got a sore throat. They had a fever and a sore throat, now they've got a cough as well.
Mm-hmm.
But that did not happen to me. I had like a 3 or 4 day break where I felt mostly fine, and then I lost my taste and smell, and that that happens with it happens often with respiratory illness. You get stuffy nose, you can't taste anything, you can't smell anything. It's pretty common, and we look at that as pretty mild. I also didn't realize that was one of the symptoms, or I didn't realize that it was a marker symptom. It seemed like I had probably heard someone say it in passing and didn't think anything of it. I was trying to think back to, like, how did I miss that? And there's just a lot of information circulating too. I think it's we're calling it a data-free zone because we don't have any information about really how to treat the virus or what medications work or what, we can't look back and say, oh, well, 6 months ago we tried this because we didn't have this 6 months ago. But there's also an incredible amount of inaccurate data or presumptive data that is just as unhelpful as having none at all. So I've had some friends say to me, well, how could you be so stupid as to not know that you definitely had COVID because you didn't feel well? And it's like, well, I'm working myself into tiny bits right now because we have a hospital full of COVID patients. I don't feel good a lot.
Yeah.
I am fatigued often. So that is something I started asking myself too. Is like, well, how did I miss that?
Mm-hmm.
Why did I not take my own self seriously when I didn't feel good?
Mm-hmm. With so many precautions being taken, I imagine that being a nurse, what, I didn't even ask you, what is your title?
I actually work in patient care logistics.
Okay.
So whenever a patient has a test order in my hospital, I do all of their care around that test. I just don't do the test itself. Our technicians do the test, but all patient transfers, I do a moderate amount of pre- and post-operative care with patients before and after surgery. I also will do their admission into the hospital from the emergency room, and I respond to code 99s. Every hospital has a different thing that they call those, but basically when someone is in cardiac arrest, I respond to those codes. So I do CPR and life-saving measures on that patient with the rest of the team that's been dispatched to treat that patient.
Mm-hmm. How long have you been taking these precautions to protect yourselves against COVID?
So we're in a rural area of New York State. We didn't see a lot of. I know we were preparing this for several months. When it became public, and maybe even before that this was happening in China to the degree that it happened. I know our infection control team was trying to get as much information as they could about this, but we did not start using really even the word COVID until the beginning of March. And things really didn't ramp up for us. It kind of happened. A lot of the realities of the United States don't hit our area until a little bit later, after it's hit other places. But once the disease came to New York State as a whole, then we started using, looking at like, okay, we need to make sure we have a way to get everybody N95s. And we've got to figure out how I know our infectious disease team has been looking at since February. All right, what's our algorithm for diagnosis here? What is our algorithm for treatment, for testing, for determining who wears what mask and when? We've got all these fun posters saying, like, this is when you wear a cloth mask, and this is when you wear an N95, and this is when you wear a surgical mask, and educating our staff about why are we wearing cloth gowns instead of rain slickers and things like that, or is it okay to wear a bandana if you don't have a mask, or, all of these things that we've seen in the news. We have a smaller hospital. We have not been inundated with patients in a way that New York City hospitals have. So we have, I want to say, the luxury of wearing designated PPE to care for our patients rather than wearing whatever's available. Because the other hospitals are having to wear whatever they can find to protect themselves.
For those who don't know, what's PPE stand for?
Personal protective equipment. So gloves, mask, goggles, gown.
All right, so I was talking about me when I said PPE. I hear it often, but I was like, maybe I'm supposed to know what it is.
Yeah, it's a term that I never really used before.
Mm-hmm.
This happened. It was like a term that I would hear when I would go to infection control trainings, and I would be like, yeah, I'm going to just continue to call that my mask.
So all of these precautions were put into place, and yet you still contracted the virus. Is it just that unavoidable, or what? Was there more that could be done?
I wonder that, but I also, we talk about this a lot in my department because we come into contact with so many different patients, and I work with other providers who don't have to enter my patients' rooms. When that patient has an isolated organism that they are dealing with. So a lot of the antibiotic resistant organisms are something we isolate if a patient has a suppressed immune system, that kind of thing. We do precautions like what we use for COVID, but not to this extent. So my coworkers and I talk about this a lot. People don't become more contagious when they enter a hospital space. They already have that. They're just as contagious at Target as they are when they get to the hospital. They're just as contagious at the gas station or in their own home, or at a restaurant. And it's great that all of those places are not open now. And that's one of, COVID is contagious enough that we really can't have those places open. I don't think that my hospital could have done more for me as an employee to prevent me from getting COVID. They definitely, it's a hospital and it's a microorganism, just like a school or an airport or a business building. There's all different things that go on in there that make it unique. I also think that I did sign up for this. Global pandemic was always on the table. Even though that isn't something that I ever wanted to experience, I work in healthcare, and so even though this is just really scary and stressful and undesirable, it was always possible. It's not the first time we've had a pandemic. It's not going to be the last. It may be the only one we experience in our lifetime, but this was always real. I do not know where I contracted the disease. It could have come from work. It could have also come from one of the very few trips that I have made to the store in the last month. I am not surgically scrubbing and gloving when I remove my gloves to get back into my car after running and grabbing a few things at Target or picking up a delivery for myself to eat. So there's so many possibilities there, and I think there's so many possibilities for every person. It's like we do really need to take our precautions, but we're still just people, and we might get sick. That is the larger reality in all of this, is that should we run out and reopen our state? No. Not a good idea. But is it still possible to get the disease even though we're careful? Absolutely.
I want to make a very important comment here that Target is not sponsoring this podcast episode just because you may.
It's a lot.
So your symptoms are very mild. You used the word mace something.
Malaise.
Malaise.
Yeah. I think it means like just feeling kind of sick.
Yeah.
In general, like it's no particular type of sickness. And we keep putting it on like posters and things like that. Do you feel general malaise? And that could also be like a condiment or something.
So you have COVID and we're able to, well, you have COVID-19. I don't want to call it COVID because it's not COVID, it's COVID-19. You have it and we're able to sit here and have this conversation. You're not breathing heavy, you're not blue in the face or dying, you don't look sick, and you tested positive and you have mild symptoms. You still could have passed this on to someone who may experience severe symptoms. What are some of those severe symptoms? Is this where you get into the shortness of breath and then I don't know what else there is?
So the more severe cases of COVID-19 look like, as far as I'm aware, severe shortness of breath. So shortness of breath is something that like you might experience as a healthy person after climbing 2 or 3 flights of stairs pretty fast, and all of a sudden you're breathing a little heavier. You feel like you need to do more work to get air in your lungs, to feel like you've gotten a deep breath in. I'm having very mild shortness of breath when I lay down at night. That's pretty much the extent of my shortness of breath. I have not tried to do any exercise, but I don't do a lot of exercise anyway. So, what we're seeing in patients with this illness that is severe is also a dry, very persistent cough that is also preventing them from being able to take those deep breaths and get enough oxygen. Additionally, a higher fever for a longer duration. Fevers bring lots of, really undesirable physical feelings that suck a lot. So a lot of pain, a lot of weakness, chills, pretty severe body aches. Mine definitely were severe. I felt like I hurt from the tips of my hair to the bottoms of my feet. And that, which is not at all uncommon for a fever. Any fever could feel like that. But the COVID-19 febrile state is usually a little longer than just 24 hours or 48 hours. And it may come back, your symptoms may reduce and then amp up again. And that's something that's like kind of the sneaky piece of the disease.
Mm-hmm.
We're also, a lot of people have reported nausea and vomiting and diarrhea as well. which can cause severe dehydration, further weakness, and can really kind of tank you in your body's ability to fight what the virus is doing. And then we get into airways and lungs. It causes a lot of inflammation and a lot of scarring in the lungs, the trachea, your basically your throat, your nose, all of your airways, and those can kind of shut down and stop doing the work that they usually do to get air into your lungs. And that can be one of the reasons that people wind up in the hospital. And when we're not getting enough oxygen, that can shut down our other organ systems like our liver and our kidneys and our heart. So we are losing patients to multi-system organ failure and to respiratory arrest.
Okay. With it being allergy season, is there more of like, how do we differentiate is what I want to ask.
I think the kind of creepy thing about COVID is that it can look or feel like allergies. I was asked many, many times when I think originally got sick and didn't know I was sick. I went to my fast track in my emergency room and said, I don't feel good. I know I'm running a temp. I thought it was because I had an ear infection because they get them monthly, just about. And they said, they sent me home with an allergy prescription. It was around the time that I was the most contagious. But it was also before I started running a high fever. I think if I had gone in there with a high fever, they might have treated me differently in terms of what they chose to do medication-wise. But, yeah, I think allergies, and I don't have allergies, but allergies I know usually affect people's eyes and noses and throats. Sometimes they can lead to respiratory illness, like a sinus infection or another upper respiratory. Feels like a cold, you get a cough, you get congested, you spit stuff up, you feel kind of gross for about a week, or it happens over and over. I think allergy season pretty tough, but you get itchy, watery eyes, runny nose, scratchy throat. With the exception of itchy, watery eyes, runny nose, scratchy throat, and a cough is consistent with COVID symptoms. So I think doing self-monitoring is really important, like saying, I don't feel good, so I'm going to call my boss and not go to work today. Okay. I worry for people who are in employment situations where they are frontline care or they are considered essential. I feel like if you're a boss in the United States and somebody calls and says, I don't feel good, I'm not coming to work, there is like a mark against that person for not showing up that day. We don't treat illness like it's a good reason not to come to work in the United States. I'm not a fan of that mindset. That is definitely one of the reasons. Like, I was ready to go right back to work and give everybody COVID-19 that came into contact with me. Because I am not in a situation where I'm going to lose my job, but I do have that mindset. I don't want to lose my job. I don't want to get in trouble at work for missing work. I'm a unionized employee, but that doesn't really make a difference for how I personally feel about how I might be perceived for missing work. So I think as just to be responsible is to self-monitor, but it's also to say it's really hard to put your foot down and say, I'm not going to go to work when you're under pressure from your employer to be there.
Right.
And it can be really scary for employees to say, I can't, because there's a lot at stake.
There is. And so you get diagnosed and you just get sent home. There's no special treatment. There's no medication to ease potential symptoms. You just are supposed to go home. What about the people? What's the difference between you and people who have to stay at the hospital? Like, what treatment options are there available that allow for you to just get sent home and for us to be in quarantine, social distancing in order to keep people from getting this virus that we are potentially going to overwhelm the healthcare system with if the general treatment is for you to stay home.
Yeah, so the general treatment, and I think honestly the majority of people who have COVID-19, we just want people to stay home because this can spread like absolute wildfire in a place like a hospital. I mean, it's got a totally captive audience of people, thousands of people who work in pretty tight quarters together. Diseases viral illnesses like stomach viruses and stuff like that can fly through a hospital. COVID-19 is no different. I am self-treating with Tylenol. And I am drinking a lot of fluids and trying to eat when I have an appetite, and I'm resting. That's really all I'm doing, and that's all I've been doing. I would imagine that people who are able to stay home with COVID-19, who are having trouble breathing, I'm not sure exactly what the inhalers are that are being prescribed, but I know there are physicians prescribing inhalers just like we would with asthma, because they can help kind of open the airways up and allow people to breathe a little easier. I think the drugs in each of those inhalers are going to be different based on the patient.
Okay.
At the hospital, we have respiratory therapists who do breathing treatments with our COVID-19 patients who cannot breathe. So that's like an inhaler, but it's on a much larger, more effective scale than an inhaler. So we've got nebulizers, we've got high flow oxygen. We're also able to keep people on larger amounts of oxygen than they would be able to use just at home with an oxygen tank, because we have in-room oxygen with much larger tanks. So they're not going to deplete through that as fast. We also have patients who are ventilated or who are intubated and then on a ventilator. So that is the machine that breathes 100% for them. We have something called BiPAP as well, which is a highly concentrated oxygen. I don't know if you've heard of a CPAP.
Yeah.
It's what you'd wear for sleep apnea. It's kind of similar. You wear like a face mask, and that helps you breathe. And we can put medications into that. And that's something that our infectious disease specialists, our anesthesiologists, and our respiratory therapists and pulmonologists, those are doctors that work with lungs, are treating. We also have cardiologists that are working with our COVID-19 patients as well.
Okay. I would like to transition here into how you're impacted by this virus on top of having, is it oral or genital HSV?
I have genital HSV.
All right. So I am positive that you are doing everything that you can to minimize the potential of an outbreak. During your chronic fevers, first off, when you get your chronic ear infections and you have your fevers and high temperatures, do you get outbreaks during that time?
I have. I wonder. I don't have any friends who deal with this as well. But I would wonder if, like, sometimes I'm always asking myself, like, well, what can I do to prevent this from happening? And then sometimes it seems like, oh, did I, like, eliminating this from my diet or making sure I'm getting enough sleep? Like, there are certain things, but I'm not actually sure if they're helping at all or if it's just by chance.
Okay.
But I'm still trying to do those things. And I also take 1 gram of valsiclovir daily as well, and I've been doing that for 2 years. And that has definitely been really helpful. But I have struggled to find a lot of correlation in my symptom occurrences, because sometimes they come out of absolutely nowhere. And sometimes I'm like, oh yeah, I did have a fever that week. Maybe that was why. But then 4 months later, I get one and no idea. I've been trying to like not stress myself. I notice that when my cortisol levels are the highest, so when I'm in like fight or flight mode at work, or I'm like really freaked out about something and I'm doing a lot of worrying, I tend to have outbreak occurrences during those times. So I've been trying not to lose my shit.
Yeah.
Which is really hard to do in this situation and all others. So, yeah, I don't do a ton other than that, because it's been pretty confusing anyway. And I would definitely be interested to find out like what other people who are dealing with COVID-19, how they're feeling about HSV occurrences and things like that, because the illness, if your illness was more severe than mine, or, you know, lots of family and friend stressors and relationship stressors come into this too, like telling people that you're positive has been, telling people that I have this has been really like re-triggering. It feels really similar to telling people that I have HSV. So that has sucked.
Wait, so in disclosing your HSV status, you only have to tell the people who who are going to be vulnerable to exposure. Now, right. Having COVID, any points of contact
anybody.
So it's anyone.
Anybody that I have been anywhere near. So I had to have my health department call my bosses and my coworkers, and then they call I've been in contact, not in physical contact with, but I've been in the same room with some family members who live in my household. So I've been, you know, they had to call them. They called my partner. He obviously already knew. But we have had other social distancing, like meeting up with people just to talk, you know, across the road or that kind of thing, or whatever. So there were quite a few phone calls there as well, because we spent a lot of time outside.
They called your partner?
They did, yes. They called, they do your chain of contact. So, and that was for COVID, not for HSV.
Right.
But for COVID, yeah, the New York State Health Department, they do not give that person your name. They just say, like, a person who you've been in like, social contact with has given us your name as someone who they have been exposed to for more than 10 minutes at a distance of less than 6 feet. And then, like, okay, then they call you and they tell you, like, this is what you need to do in terms of how long you need to self-isolate for.
Okay. So are you supposed to just go back to work in 2 weeks, or how long is your isolation?
So my isolation will be over my isolation will be over actually on Monday.
Okay.
Which is interesting. So we are still not sure exactly how long I've had this.
Yeah.
So there's a 7-day window after infection that you are the most contagious. They do not know when I got infected. So our hypothetical solution, or like, I don't know, our hypothetical timeline here is that my quarantine should end on the 27th.
Okay.
People who have come into contact with me, like my boyfriend and my parents, and my sister who I sat next to at Easter, there were only a couple of us in the room, but we were seated, I think, next to each other or across from each other. they will come out of quarantine on May 4th.
Okay. Now, what's been their response to your diagnosis and having disclosed that you have COVID-19 to them? Are they scared for you? Is there empathy? Is there anger? What's happening?
I think I don't know, actually. I think actually, I know my boyfriend's really bored because he can't go anywhere and do anything now. Not that he really could anyway, but he is doing, I mean, it's only been a day. He helped me call a lot of people that we, like, walked by when we were, like, out walking and talked to and things like that, because I said, look, let's make sure everybody is aware.
Hmm.
Um,
Is this
that
something? Is this something that like you could make a Facebook status about, or is this something that has to be more intimate, where you only want the people who potentially were exposed to know?
I think it's totally fine for people to make Facebook or like an Instagram story about. I definitely, that was not something I was going to do. But I don't think that it would be. I am noticing that a neighbor of mine who I came into distant contact with was very upset to find out that I had been walking around my neighborhood, which is a private neighborhood. I was not out in public. That I had been walking around my neighborhood after having a potential symptom of COVID. So this is after my fever had broken and I was released to go back to work. I swung by. They were outside. I stood and talked probably 10 feet away from her for like a half an hour with her. When I told her that I was getting tested, she got very upset with me. And my timeline in terms of my symptoms and things like that, I couldn't make that make sense to her. Of why I thought I was okay, why I thought I wasn't creating an unnecessary risk for her and her family.
So, as a healthcare worker, though,
A little weird.
as a healthcare worker, you are far more credible than this. I'm gonna assume that this lady that you were speaking with isn't a healthcare worker, right?
Right.
Okay, so you're explaining to her the protocol and everything. Like, what is it that we can share here for the general public about your particular experience? So, if someone has a friend, relative that tells them, "Hey, I tested positive for COVID," how can we respond?
Well, I think actually taking a page out of our response to the disclosure of of other types of viral illnesses is important. So just saying, well, thank you for telling me, and also, it isn't. It is all of our responsibility to stay away from each other and not to touch each other and not to touch each other's pets and not to be out at bars and restaurants and in public places and congregating and things like that. That's a responsibility that falls on everybody. But it is also, it is nobody's fault that I contracted this. And it is, it is difficult to get feedback from someone else saying that, yes, it is your fault that I may get this because you came near me and didn't know you had this. Likewise, I think it's important, especially for your viewers, I'm sure a lot of people who are listening have felt a very deep sense of responsibility for the health of other people. And a lot of guilt and a lot of the things that I have felt. So I'm trying to make sure that I don't relive all of those emotions based on other people's fear-based reactions to something that I can validate it's very scary, but it's also not a good reason to place a lot of blame. Because while somebody might be afraid, getting the news that their friend or neighbor has COVID-19 they could get COVID-19 from that person, but they're just as likely to get it going grocery shopping or going to the post office or, a lot of different places that we still have to go. We have to be careful about going to those places. We have to be limiting the amount of times we go to do different things in our daily lives in ways that we never have before. But that doesn't mean that we're less likely to randomly come into contact with something that we can't see, because that is the reality. We can't see this. We can't touch it. We can't, we can't wrap our hands around it. So it's a lot scarier that way, but it's very ambiguous, like with any disease.
Mm-hmm.
So doing the tracing that our health departments do is important for statistics, but I think it can get kind of wonky and convoluted when it comes to who really needs to know.
Okay.
And what actual odds are we playing with? That's not something that we have enough info about yet.
All right. I really do appreciate you taking the time to record. I know you just reached out to me with a question and it turned into a podcast interview within minutes of us speaking. So my gratitude to you for making this time. Well, I can't say you're making the time. You said you weren't doing anything else.
I have time in abundance. Courtney. I have so much time.
Are you available for, let's say I want to post this today and then leave space for if anyone has questions for you specifically, or any questions about your experience in the healthcare field, having been exposed, and like moving forward. I'd like to come back and do like a part 2 for this. That's more of a Q&A. I asked questions that I thought were important for people listening, but there may be things that come up that others may bring up that weren't there before. So if you're open to that, can I please have you back?
For sure.
All right.
For sure. It might actually be cool to do it after I go back to work, because that'll probably, and I'll also have, an open dialogue with a lot of other healthcare professionals.
Okay.
So if your listeners had questions that I can't answer, I can bring those questions to some very smart healthcare people and
cool.
get some high quality answers in there. So that might be cool.
Awesome. We have maybe 10 minutes before I got to get up out of here because I'm practicing social distancing, right? I walk down the street to my gym and I'm recording, but someone's going to be down here working out in a bit for himself. And so, yeah, if we can just talk for a little bit more. Listeners, if you do have questions, you can either DM me on Instagram. I'm most active there. At H on my chest, or you can just email me, Courtney at SPFPP.org, with any questions that you have for our guests in regards to COVID-19 and herpes or whatever. But I'll speak here from my experience. Like, I've not really been one to really take the quarantining and self-isolation very seriously up until recently. A friend of mine, his mom contracted COVID-19 and she made it through fine. And I recently found out that someone I had went to high school with, his dad had passed away from COVID-19. And now you're the third person that I think that I'm aware of, like in my sphere of connections, that has COVID-19 or has had any experience with COVID-19. So in combination with this and a few conversations that I've had with people who are considered high risk, it's made me take this significantly more seriously. I think I go to the grocery store maybe once every 10 days and I try to go as I absolutely need to and only get my 3 bottles of alcohol and get out of there. I'm just kidding. I get what I need to get and then I'm gone. So, yeah, I like being someone who is coming from that perspective, from that space. I think that it's important here to mention, if you can stay home, or at least like have your points of contact as limited as possible. So if you
Yeah.
go to your grocery store and you make it the same grocery store, I guess, if you have to see people, if you live with people, or if you're walking past the same people or whatever, then make sure that you're aware, okay, these are my points of contact, and stay home if you're sick.
Yep. I think also, like, I'm realizing looking back at the last couple weeks of my own life, like, it's been pretty limiting to be self-isolating. But I know a lot of friends up where I live, where this is just not hitting in the same way that it is in larger cities, because people are much more spread out here. Um, we may have fewer deaths in this area than, you know, than other parts of our state, because it is so rural. I think that we lose, and working in healthcare can make, I was talking with my sister the other day, and working in healthcare makes me and my father, like, delusionally unafraid of certain things, because we can't let in how scary it actually is, because we have to work with it. So the two of us tend to be like, oh, it's fine. We're fine. Everything's all right. Even though we were both pretty socially responsible, I've definitely been closer to other humans than I should have at different points in time. And, I think everybody's getting pretty sick of all of this. And it wears down what you're willing to do, or, to keep this up, because it is a little more work. And when you have to, like, go to work and be normal, I don't know, it's like, can I say fuck on here? It's kind of a mind fuck, where you're like, okay, well, I still have to, like, go get groceries, because if I don't, someone has to bring them to me. So I have to, like, go do these sort of normal things, but I can't do them normally.
Mm-hmm. And
And
it's really
weird, cognitively.
it's hard to trust that others are taking all of the necessary precautions as well. You can take all the precautions to prevent yourself from getting this virus, any virus, and then someone else could have just taken the same precautions that you take and come into contact with a person, or someone could have just that in that moment of inhaling at the same time someone's exhaled and the virus has flown by them or whatever. There's so many different
Yeah.
scenarios here of how unavoidable it is. This really does remind me of the herpes stigma because of how seemingly unavoidable it is. We'd say wear condoms. There's so much misinformation out there that condoms will protect you from STIs, and then there's all this misinformation out here that, just taking these precautions of washing your hands and cleaning off things and self-isolating, there's no there's so much more. There are so many more questions than there are answers to anything here, and so yeah, we'll see what some of those questions are, and I'll get your email address information so that I can compile any questions that may come up from listeners, and then I'll just send those over to you. I guess once we hit a deadline, so I'll just allow there to be open enrollment, open submissions for questions for you, and we'll close it around the time you're ready to re-record and get the questions answered to the best of your ability and by the people who you're able to connect with. But before I let you go, is there a specific resource that is more credible in regards to COVID-19 that we can get updated information on?
I have personally been mostly referring to the CDC website. Also, to the American Veterinary Association, because I have pets, and I was like a little bit more freaked out than maybe the average bear. When I found out the tiger in the Bronx Zoo had it, I would have my own smallish tiger here.
Oh, look at that guy.
So I was very nervous. I was like, oh my God, I don't care if I get this, but if he gets it, I'm going to lose my mind.
Yeah, he's not worried about it. He's like, Mom, you're gonna be at home more.
They had a ton of really good information on their website as well for people who have pets or livestock. I thought that was pretty cool. I typically refer to like NPR, BBC, New York Times, Wall Street Journal, Washington Post.
Okay.
But I don't know, aside from the CDC, and I know they don't always have the best info, they're what I've been referring to.
Okay. Well, we'll stop here. I mean, I can talk to you all day. I've got a lot more questions, and I think that, yeah, the biggest takeaway from this is just really stay home if you can. Limit your points of contact if you absolutely have to, and practice just normal hygiene stuff, right?
Yep, wash your hands and wear your mask.
Okay. This concludes part 1 of this episode of Something Positive for Positive People. Please like, rate, review, share this podcast with whoever you feel may find it useful. Yeah, this is this is just going up, so now I'm all nervous. Usually I can just blow through these and then edit it at the end or whatever, but we're just gonna post it. This podcast is a number of things: suicide prevention resource for people diagnosed with STIs, and an emotional support aftercare resource for people who are navigating stigma at STI diagnosis. This is a useful support tool for them. So if this is your first episode listening to this podcast, please go back and listen to literally any of the other ones. Episode 0 is actually a bonus episode, and it can be found right after episode 100. That's probably your ideal starting point. But yeah, given the circumstances of the quick turnaround time of this podcast interview and the pandemic that we're in right now, I wanted to make sure and just get this up and get it out there now, and then we'll come back with questions later. Till next time, stay sex positive. And stay at home if you can, or limit your points of contact. All right, bye.